there have always been what we now call vaccine hesitant people who really don't want vaccines. But this phenomenon got an incredible jolt in the late 1990s when some less than rigorous investigators published work that linked vaccines to autism and increasingly to a broad array of childhood diseases. Now, having chaired one of the several committees that have looked at this issue, there is no evidence to link autism with vaccines and considerable evidence to the contrary. But nonetheless, those who firmly believe that this is the case have become very, very vocal. And to the point that among American parents currently, some 25% will express some concerns about vaccines. Now, the vast majority get their children immunized anyway, but there is this growing concern that's fed by the internet that people don't have time to dig into the literature. They see it, they feel that there must be something there. And so that has set up a tension because most public school systems require complete immunizations for the children to enter school. And if you don't want to immunize your child, then you've got a problem. And so what has emerged as a way of parents dealing with this are called exemptions. And there are three types of exemptions. One is medical exemption. That is, the child absolutely cannot take the vaccine. They're allergic to it, they're immunosuppressed. The second is a religious exemption, which says my religion forbids me to have them. And then the third is philosophical or personal belief exemptions, which are exactly what they sound like. I don't want it. Okay? And it's very clear from the data that states with liberal exemption regulations have higher rates of vaccine-preventable diseases. This has been documented repeatedly. What occurred in this past year, I think, which galvanized the people who sort of say, well, this is not my issue, I don't need to fight this, was the spread of measles from a single case in Disneyland to 132 cases across the country. I think people began to realize that it's not just a personal decision if parent X decides not to vaccinate their child. That has implications for my child's health as well. And in particular for those who are unable to have vaccines, such as those with medical and contraindications, small babies who haven't had the chance to go through the full immunization schedule, and the elderly for whom immunization sometimes wanes. And so there are, real consequences of not having everyone vaccinated at the level that you can prevent the spread of disease, the 80-90%.